and note that the session is recording, but we'll go ahead and get started. Thank you all for attending today's session on integrity and sanctions and exclusion management. We're going to talk about kind of a radical new approach to managing this process for those of you who are doing so. My name is Tom Leahy. I'm the head of sales and business development with SureShield. I have been in healthcare for close to 30 some odd years and done a lot in the areas of compliance, security, and patient safety, as well as policy management, contract management, and the likes. And obviously, sanctions and exclusions become a big part of your whole ecosystem as it relates to your vendors, your employees, and the providers who are working with you. I do have with me folks from our Chandi Bilagu, who's part of our development team, who's primarily responsible for the product that you're going to be seeing today, and then a couple others who will be here with us to answer any questions that you may have. We'll start in talking about a little bit about OIG oversight, which those of you who are in attendance, I'm sure know plenty about, but speak specifically to some of the ramped up efforts and enforcement efforts that we're going to be expecting, the challenges you have as a provider to try to manage this process throughout your entire ecosystem, and the risks that come with various ways in which that may be done. And then we're going to talk about how you can leverage technology delivered by SureShield as a new approach to be able to manage your entire ecosystem, whether that's your employees, your vendors, your providers, and do it in a manner that does not require you to add any additional resources, to be constantly surveying that ecosystem so that if there's ever an abnormality as it relates to a sanction or exclusion, you would be notified and know about that immediately. So a simpler way to manage this and a safer way to manage this, and it's also a much less risk, providing a more sound compliance oversight for your organization. We'll show you the product briefly, and then we will get into some questions. We'll also take a brief poll for those of you in our attendance. We are going to give you the opportunity, I would say, to test this out, and really an easy way to test it. I would encourage you to take advantage of this and match it up to the processes you have today. It's a very easy, simple way for you to even just test it out on a few of your providers to see the kind of information that you would get back. So as all of you know, obviously, as it relates to the Health and Human Services, there's kind of two oversight groups that enforce things related to preventing healthcare fraud and also protecting critical PHI data. Under the OIG, as you know, the Office of Inspector General, they require that any organization that works with vendors and individuals who are sanctioned or excluded, making sure that they're not sanctioned or excluded from working with federal or state programs. In doing so, as you know, can come with very significant fines. So the OIG oversight has to do a lot with the fraud and abuse potentials that take place in enforcing that and making sure that that's not happening. Of course, as we'll get into the next slide, the pandemic has certainly increased the number of bad actors that have come in to try to take advantage of those situations. And then, of course, we have the OCR, the Office for Civil Rights, that enforces HIPAA. For those of you who may be participating next week, the HCCA, the Healthcare Compliance Association conference, is in Phoenix, and a lot of part of the agenda there will be talking about and getting input back from the folks that lead those organizations in terms of their activities. But really, what they've indicated, and if any of you had taken time to listen to the most recent State of the Union address by President Biden, one of the items that he brought up was adding more resources to enforce and go after bad actors that have come in as a result of the pandemic. There's been a tremendous amount of healthcare fraud and abuse that have taken place during that process. And as such, they're actually going to be increasing enforcement efforts to make sure that those actors are captured and that anyone that's dealing or working with those is dealt with in an appropriate manner. Today, just over the last year, there's been over 1,400 sanction and exclusion actions that have taken place. And that number continues to rise. You know, in 2021 alone, there was over $6 billion in investigative and audit receivables. As all of us know, when we work with anything to do with the federal government, if we're getting payments from them, they're going to make sure that those payments are legitimate. And if they're not, they are going to take very swift action to enforce and repay any of those items that have taken place. So the importance of that is that, and what they indicate and recommend is that you as a healthcare organization need to have a very strong compliance process in place to make sure that you're not working with any of these sanctioned, excluded providers. And that can be a very difficult process because there's over 4 different federal databases that need to be checked. Those lists are updated daily, so there's always new additions to entities or individuals that have been excluded. They encourage, you know, and as such, any given day, you could have a new actor that's come in your own ecosystem that you may not know about. So first of all, and this is probably something you're doing, you know, most organizations are doing right off the bat, is they're screening all new employees, providers, contractors, and vendors. They're putting them through those checks initially upon hire. Where the complications come in is on the regular screening of those that then enter the ecosystem. Now, the OIG recommends that process of checking and doing these screens is done monthly, at least monthly. The fact of the matter is probably only, if lucky, 10% of healthcare providers that have to do this are doing that, even on that frequent of a basis. And why is that? Because depending on the size of your organization, you know, you have hundreds, if not thousands, of different entities that need to be screened. And so trying to do that in an efficient manner without good, I would say, tools and good processes becomes quite cumbersome. So, of course, our recommendations are to do this monthly. And part of that is also you need to have a good process in place because you need it in the event that you actually happen to have someone, and in some cases, providers do identify and they report that they have someone that's been excluded. While you get less of a slap on the wrist for that, you still get significantly punished. And what will reduce that is, of course, being able to provide a solid proof of screening activities that you have in place, how frequently you're doing, the dates that you've done that, the databases that have been checked. And lack of that proof, should a bad actor get in, can result in even higher penalties. We're going to show you how you can avoid that ever happening, never having someone come into that environment if you utilize technology like ours. And they want to make sure that you act quickly on employees, providers, contractors that are identified and then report them to the OIG. Just recently, in terms of looking at just the LEIE database alone, there are over 80,000 providers and businesses that are currently in that list. You combine that with the other federal databases like the SAM, the OFAC, and then take into account that there's 37 states that also have sanction and exclusion processes in place. You're easily looking at over 100 to probably over 150,000 different providers that are on these lists, keeping in mind that they are updated on a daily basis. How you can keep track of that is actually quite cumbersome. And what are, some examples of recent exclusions and the impact that that has? And I will actually point out to you a couple of things just in terms of one of these particular ones as well that could help an organization avoid even the future potential of a problem. So here's a few examples of some recent exclusions. These are all within this month of as recent as a couple of days ago. The Wyndham Eye Care practice, and I believe it's in Florida, they penalized and fined this practice $190,000 because they had employed an individual who had been excluded from all federal health care programs. They may not have checked, they may not have known, but it became a fact. And as that happened, you can see what the results of that were. Penn State University, almost $1 million in fines because of the fraud and abuse that had taken place that was not recognized and identified. And this last one, keep in mind, this is a physician group that was recently came to a settlement with the OIG, paying almost $500,000 and being excluded from all federal healthcare programs. Now, look at the end of this line, for 3 years. So you have the potential, just like someone going to jail, when their jail sentence is up, sometimes they are allowed to come back and participate. So this particular provider right now is being excluded for 3 years. After that time, this person could be coming back into providing services. That doesn't necessarily mean that he or she will continue to follow those types of practices. But if it were my organization, I'd want to know, if I was bringing someone like that in, whether there was some past history, even if they're not on the exclusion list right now. So as you'll see, as we walk through, and this is also a very complicated thing, you may do a check currently and find that there's nothing on there and not have the knowledge that that provider, that business had been on that list before. And as such, it can put your organization again at peril or risk. And given the thin margins that we have in healthcare right now, you can imagine the difficulties and the cost associated with that, not just from the costs. Healthcare, as we know, is competing for patients, and you're competing for profitable patients these days because of the cost of the pandemic care. So having those kind of things happen to you as an organization can be almost catastrophic. So what are the challenges, obviously, of this process? It can be very expensive. Oftentimes it's manual, time consuming. Organizations are either doing this themselves, and they're doing it manually, and they're using Excel spreadsheets. They're periodically checking these databases and then updating them. There's really no automated access to all of these databases, meaning a way for you to be informed almost instantaneously under the current processes of whether there's been any new additions to this list. They're either manual, or many organizations use outsourced agencies that will do these periodic spot checks for them. You will package up a list of providers and companies, you'll send it off to a company that will go check. They will do a check. They will send you back a validation or a verification of a yes, a no, or a thumbs up, thumbs down, thumbs up and thumbs down, depending upon the numbers that they're checking. And then that becomes a static issue until those checks are done again. So there's no way to actually do this continuously and daily with those types of tools. And it's really impossible to monitor your entire ecosystem on a regular basis. So what do a lot of healthcare organizations do? If they're that big, they're either taking their time and they're doing static checks, or they are limiting it to the companies that they may think could provide the biggest amount of risk for them. So they're stratifying out, and they're segmenting out, and then leaving a whole segment of providers unchecked. Again, it's, that can work, and sometimes you don't have issues, but it's just like not having insurance. I failed to take my, to have my fire insurance because I don't think there'll be a fire. Well, that fire comes and I'm in big time trouble. So how can our company, SureShield, help you with this process? We have a tool called Integrity Shield that actually will do this whole process in a real-time, automated, and continuous manner. We monitor and measure and look at all of those databases. We have technology, underlying technology that can do regular monitoring of each one of those databases and update that daily and match that up against the provider and vendor and employee list that you have within our system, and do real-time automated checks. The other part of that is very beneficial to you is you're not having to do this and send this out for providers that, let's just say, you're not sure. The system will do that for you. You're going to get what we call real-time alerts to let you know. Think of it as exception-based reporting that will tell you if something looks wrong within that environment, and will alert you to that and point you to that so you can take the appropriate actions you need to take on that, as opposed to getting a report that said that you sent out that says my 100 providers are fine, oh, but one of them isn't, right? You want to know where the problems are that you need to address. Really setting this up can be deployed really in a matter of minutes. And we say 30 days to get you a little acclimated to it, but starting it and utilizing it can be done in a matter of a couple of hours, having you up and done ready. And it will provide and perform those integrity checks against those databases on your entire ecosystem, as you so choose. If you have the ability to determine that you may only want to do it on certain entities, could it be a vendor, could it be a contracted worker, an employee, a business associate, either way, we can help monitor that entire ecosystem and provide you a great rich library of reports, comparative analytics, and most importantly in that process, as we talked about before, a full audited paper trail that can prove that you were taking the actions and the appropriate actions needed to take in order to monitor this. Should something slip through the cracks. In our case, they never should, because you're always going to know instantaneously if you have an issue. So just as kind of just a visual, if you look at the current processes versus the SureShield integrity process, on the left is what I would call the current process. And I'm going to give a comparison to how this changes with SureShield. So let's say we've gone into and we've taken this is the same provider. And on day one, we did a sanction check. And during that sanction exclusion check, we found in a manual process and with the SureShield process that nothing was abnormal. Person wasn't on the list. Nothing had been, brought to their attention. They had not gotten in trouble. They were not added to the list. 2-3 days go by, and that in a manual process, that person is added to the list. And I'm making an assumption on the left-hand side that you as an organization are doing this process on a 30-day, on a monthly basis, right? Most are not even doing it in that time frame. So just, you can do the multiplication if this was out for, let's say, a quarter, 120 days, what the potential impact of that could be. So on day 3, this provider is sanctioned. Assuming that we're doing this on a monthly basis, we have now gone another 28 days and done another check, and now we find out that that person's on the list. Well, during that time, that person could have also been providing services for those 28 days. So during that time frame, if they were providing services, as you know, from a penalty standpoint, it's up to as high as $16,000 per claim. And that's not to say in those 28 days that individual may not have done more than 28 claims. But just for some perspective on the potential impact of this, that's been identified. It wasn't identified for another 28 days. you now have a potential liability of almost $500,000 in fines and penalties coming to you. Now, contrast that to the SureShield process on the right. Our system, like I said, is doing continuous daily updates of this. So day one, we've identified this individual as being okay. However, on day 3, they entered the database. You are immediately notified that there's been an abnormality, and this particular practitioner has now gone onto that sanctions list. What it allows you to do instantaneously is first, take actions to suspend privileges, or say that we're going to hold off on letting them provide services until we validate this. So you can take that information then and also do validation checks against that to make sure that there's nothing abnormal, because occasionally there are false positives. And we provide you a way, which we'll show you, to be able to check all that. But you'll immediately know. You'd be allowed to then pull and stop that, so that in this case, that person is sanctioned. You've stopped it. You are not subject to any fines. You have a complete compliance process in place. And by the way, you didn't have to add any additional resources to do this as well. So we won't go long into this, but this just kind of gives you a visual of kind of our back-end process. So at the bottom of this are all the databases that we are sourcing. We put that into a ETL process that pulls all this data in. It compares that to the data sources that we have on your organization. It deduplicates information, and then it will actually present that to you and give you a thumbs up, thumbs down on a daily basis. Of course, you have reports that you can take back as well to see how you are complying with this at any given time. Again, the difficulty in this process, think about it. You've got today over 4 federal lists and over 37 states. If you're a provider that is working in multiple states, well, then you need to actually be checking those individuals for activities they may have in multiple states. Or you have a new practitioner that came in, let's say to Georgia, that had formerly practiced in California. Wouldn't you like to know if that person had previously or is on a California sanction and exclusion list? So I'm going to take a brief pause here and now show you just an overview of how that our system works. So I've gone into what we call our integrity shield for sanctions and exclusions management. And you can see this all gets performed in what I call a dashboard view. So it's going to tell me in this dashboard, in this case, we're a relatively small, I would say small, large physician practice. You can see that I've got 193 records in here. And they show you what the stratification is. Are they employees? Are they entities? Are they individuals? You'll be able to see, for instance, within there, if there's been any exclusions. In this case, we're identifying that there's 11 on this list. If I were to go into this, and hopefully this would never be your case because you're going to see them as is, but just to help you understand, it will flag in this area and all of a sudden turn this to red, telling you we've got an issue. I can go into that and it's going to show me all of those. On the right-hand side, again, you have means to stratify this. If you want to just look at, say, your business associates, your employees, your vendors that are within here, what their classification is. And if I were to go into this particular provider, I can see what are the issues and what were the databases that they've shown up on, right? So you can see here, this particular organization showed up on the Ohio Sanctions and Exclusion list, the SAM and the LEIE. And if you were to click into there, you will see what the reason is for that. You'll also note here, again, as I pointed out, if there had been past issues with this particular provider, let's say they're not on the list right now, or they've been brought onto it again, we can actually show you past history. So as you're running someone, let's say a new provider into the list. It will tell you today if there's an issue and whether you had issues with that provider in the past. And that may help you in terms of making your decisions about whether you want to bring that provider into your environment, ways that you want to contract with that entity, knowing that information. You'll also note that we have workflow built in that allows you to do things like initiate a request for data or a verification. Occasionally, again, you can have issues where a provider, because of name likeliness, things of that nature, addresses being similar, could show up and you'll want to validate that. Naturally, you'll want to validate and make sure that that's the case. And then you can initiate things like a request for verification, where you can send this out to individuals and say, hey, I need you to validate this, or I want you, a request for data. So I want you to come back and tell me that we need information to get this better, under control, or make sure that there are no issues with what we are doing here. So as you can see, a super simple and a continuous process. Now, if you want to bring people on board, it's really as simple as going in and indicating that you're going to want to add them as a vendor. Excuse me. And it's as simple as just saying, I want to add a new record. You can do that one by one. You'll notice you can do that either under someone who's contracted already or a prospective individual. You can indicate what the record type is on that individual, get some preliminary information. And actually, when you go onto the next screen, it will actually run a sanctions check on them instantaneously. So I'm just going to go in under this synaptic group, and it can show me right here that in this case, nothing has been initiated on this group. And so I'm in good shape in working with this, at least from a sanction and exclusion standpoint as well. You can also do this by uploading records. We help you with that process as well in terms of getting outputs that we can bring all those in. We also have automated tools so that on a regular basis, a daily basis, you can have this updated and have all of those providers checked as well as the new providers checked in the database. And then lastly, within there, you have a number of different reports that you can run here. They can be exclusions and sanction statuses that you want to be looking at. All of these, again, can be segmented and filtered however you see fit. We also have the ability for you to have these reports scheduled so that you can send them out and have them go out to individuals within your organization, to people or individuals on however frequent a basis that you like. So we have lots of clients that are using this. You'll see testimonials in regards to the ease of use and really helping make sure that they have the most efficient compliance process in place with this, because the cost of one provider said the cost of non-compliance or not doing this is noted in the Federal Register, meaning you can become, get yourself in serious trouble if you have not only one is not having a good process in place. That's one, but not having a good process in place at all provides significant challenges and potential penalties and fines for your organization. So again, we have this used by physician clinics. We have it used by surgical specialty clinics. We have the surgical management clinics. We have them used by large hospitals, critical access systems. It also provides a means for you to bring this potentially back in-house at a far, far lower cost than what it's costing you now if you're outsourcing it. A lot of reason that this is often outsourced is just because the resource, constraints that you as an organization have and the time constraints you have in doing this. And so they're ending up expending more money in still what I would call a riskier manner, because it's not done on a consistent, regular 24/7 process. And as such, even doing that is going to cost you more and provide you less protection. So, key benefits, obviously, of the tool. It's really simple and easy to use. It will provide a full, complete ecosystem coverage. It has workflow built into it. You can even push this off. So if you're an entity where maybe different departments are responsible for doing components of this, HR is supposed to do employees, med staff is doing docs, maybe your supply chain is doing your vendors. You can push that work out to others, but have it all centrally managed and have it in a centralized compliance management process that again demonstrates a sound continuous compliance and corporate compliance, healthcare compliance program. So, to summarize, and we're going to go ahead and open this up to any questions. We will also, prior to going into that, I'm going to just launch a very brief poll for those that you are participating. That should you be interested in testing out this tool, we will make it available for you. Please go into the poll, answer either yes, no, or maybe, and that will help us. If for those of you answering yes, we will be following up with you shortly to get a trial set up for you. And again, as I mentioned, this is probably one of the easiest products to trial. You can go ahead and compare it to your current system as is right now to validate against it, right? I'll keep that poll open as we go into some of the questions that folks may have. Obviously, as we've heard from our president, they're going to be increasing the enforcement activities around that and look to seek payment for those that have bad actors that may be working with their environment. Obviously, the challenges of COVID have strapped your resources, so it's important to have tools that can help you avoid this while not adding additional burden to an already burdened system. And of course, this can help lower your risk of your organization. And lastly, we'll provide for you a full and complete paper trail of a structured compliance program. So I'm going to go ahead and keep this poll open. For those of you that continue to be on the call, I see that actually no one has dropped off. We'll go ahead and open this to Q&A. If you can go onto your Zoom area, you'll see a Q&A button. If you can click on that, we can go ahead and open that up to any questions that folks may have. Okay, and so I see one of the first questions that folks have provided are, how is this costed? That's the beauty of this. Again, it's a subscription for the service or for the software. There's no implementation fees. We help get you set up. It's a web-based tool, so we can activate it for you in a matter really of minutes. And then it's kind of stratified based upon the size of your organization. So, sliding scale up. If we're checking, 100, that subscription price is going to be, different than if we're checking 10,000. But it is an annual subscription fee that's fixed. So that it's also a fixed fee that's locked in for you for that. And look at that issue of that provider. The example of that provider where you were facing the potential of $500,000 worth of fines. I can tell you that this would be a mere pittance fraction of that cost for utilizing this technology. And that's, again, why our providers and the people we're working with love it, because it's very cost effective. It gets them to take action on things that they actually need to take action on. and it provides them that security and that full, complete audit structure to show and demonstrate that they have that process in place. Should they ever be, subject to an audit, and that may not just be by the OIG. Keep in mind, they can come in for a lot of different purposes. And when they do that, they're going to want to see your complete compliance kind of process and oversight, and you can show that you have a very structured one utilizing a tool like this. So those were the only questions I had on pricing. And then the other question had to do with, the false positives. The answer is you can get those. What we encourage is there's a fair amount of information that you can have on that provider. Not all of it is required, but the more information you have on that provider or that company, the more likely you will not run into any potential issues of, I would call it false positives, because, there's lots of John Smiths and Tom Leahy's and Sanjay Kumar's, out there, that the more information you have specifically on them will help avoid those types of issues. And that is, again, how with that back-end process, we run it through a number of algorithms to limit the number of any potential false positives that come up. Keeping in mind as well that we also have a means for you to do validation through the workflow automation on that as well. Okay, so again, for those of you who have participated, we appreciate you joining today. You will be getting a follow-up email with this presentation, as well as the access to the audio webinar portion of this. And for those of you who have indicated an interest in starting a trial of the product, we will be reaching out to you to get that started. If you're looking at this later, we will continue to keep you informed of activities that SureShield is taking and new things that we're doing. So again, I will close the poll shortly, another minute or two for anyone that's still remaining to indicate a yes, no, or maybe later. And we will continue to keep you informed of things that are going on with SureShield. So thank you so much for your time today. And hopefully we can help you in your compliance efforts. Many thanks. We'll go ahead and conclude the session then.